Good evening. Hi everyone, we're back live again for PCS Wednesdays, and today's discussion is going to be based on teenagers, and I already anticipated being a part 2 series, just in the volume of information that's available. So welcome one in. Are we still saying Happy New Year? I've lost track, but it is a new year, and we have quite a good lineup for the next few weeks coming. So I treated myself to a little break, and I hope everyone else did enjoy their holidays as well too. So tonight we're talking about teenage girls and also what I call tweenagers. Just a little bit of my background in terms of all the years of gynecology. Adolescent gynecology was a big part of what I do as well too. So I would typically, in the Bronx where I worked and in Brooklyn, I would typically just give up my Saturday and have a teen-based clinic for most times for several years. So I'd show up to the teen clinic in t-shirt, jeans, and that's one thing I would always advise parents in terms of, figuring out and navigating your teenager or your tweenager is to remain relatable and remain accessible, and that fosters an environment of communication. You want to keep them chatting so you can, be clued in when stuff is going on with your kid. In terms of the term tweenager, I think it goes without explanation. It's the young girl who's not yet a teen, but she has the elements of becoming a teenager, and teenagers become teenagers, right? So teenagers go through many physical changes, emotional changes, body changes, and social changes as well too. That as teenagers transition into adolescence, it's something that can be quite jarring and actually throw the whole household off because your child is morphing into this new person right in front of you. So the biggest change of all would be puberty. And puberty is the process of becoming sexually mature. And for girls, it happens anywhere between age 10 to 14. We have what's called precocious puberty, where it may happen a bit earlier than age 10 to 14 in girls. Boys are a little delayed, where puberty in boys, really is between age 12 up to 16. So you may have a very boyish 15-year-old son who's not yet entering puberty, still not a cause for concern. Girls, however, usually by age 10 through 14, they would have entered into puberty. And again, puberty is your sexual maturation that's happening. So these kids are going through, hi, good evening. These kids are going through changes in their body. They may have questions about what's going on. Most times they don't understand it. And during this time, they also start to develop new personalities of, just unique personalities coming out in this age group, and opinions beyond, right? I'm sure the parents in the room who have teenagers and tweenagers can relate to the fact that this is when they share their opinion with you. They want to chime in. And there are more changes that occur as well. And again, some of these are noticeable and some are not. But that increased independence from parents is important where I come in, because, kids in the teenage years, they have a lot more concern about their body image and their body function, even their clothing, their style. And as they become independent from the parent, they may be making choices independent of their parent that will impact their health and impact their bodies, because remember, their bodies are on the way to becoming the adult version with adult functions. This is when your kid's shoes, the teenager years, the shoes don't fit, the jeans are too short, the rapid changes are happening. And that's happening inside and out as well too, right? Now, when you get to this stage as well, you have to accept a teenager, especially females for some reason. Hi, my mom is locked on. Girls, teenagers, they are influenced by peers. They have a greater ability to tell right from wrong, so that can cause conflict with your parenting style as well too. And all of these changes, you want to observe your kid for things like seeming overwhelmed very easily. They have just a sadness or moodiness that's happening with them, and brooding. Brooding is something that teenagers do that we consider normal, but the sadness and the moodiness, we do accept it to a certain point. But if they're continuously feeling that way, or they're feeling helpless or worthless, and they have having issues with school, don't delay in speaking with a school counselor or someone more professional, because this is where a teenager can really have a lot of mental health issues affecting them as well too. Now, typically, a woman won't come in to see a gynecologist like myself until they turn maybe 18, closer to age 21, when a pelvic exam is needed for some reason. And of course, the pap smear testing should begin at age 21. But some health concerns and symptoms may require being seen much earlier by a gynecologist. Now remember, girls in puberty, I said age 10 to 14, so girls can get their first period as early as age 9 and as late as age 15, which key markers to understand when you should or should not bring your daughter in to be seen. So some people get it as early as 9, and sometimes it lingers until age 15. Now, what to expect at a gynae visit with a teenage girl is important as well too. Now, by the time most teenagers come into the office, I will politely ask the parents to wait in the waiting area. And this is typical, and it's not in any, personalized way. I just like an opportunity to speak with the child on their own, and we may discuss their sexuality, sex in general, sexually transmitted infections, and even their gender identity, and other sensitive topics like their relationship to alcohol and drug use and so forth. And then I can sort of suss out the need to screen your child for sexual infections, or discuss birth control or not getting pregnant and so forth. But there are some reservations. I mentioned birth control. There are some reservations in treating teenage girls with the pill. But, I'm going to say that we prescribe, as gynaes, we prescribe birth control pills for so many reasons other than contraception. And it's to treat acne, which could be quite scarring and disfiguring, very painful irregular periods, which can really be disruptive to a child. But, in the rollout of how to manage and treat things, sometimes I will encounter some resistance where the pill is concerned, and I don't ever force it on anyone, but sometimes there is need for that as well. When a teenager is coming into the office, we will always require parental guardian permission for treatment. That's an important thing as well too, because if a teen is getting into some activities that they shouldn't be yet involved in, we still, even though we don't divulge the full nature of what's being treated until we assess the situation, we still require that permission. So that's important with minors. Now, you should not expect a pelvic exam to be done on a young girl if she comes into the office. That's including the speculum, unless if there is some sexual activity already and the speculum exam is warranted based on the type of complaint. But most times we avoid it. The gynae visit for a young girl tends to be all conversation, lots of discussion and conversation. Basics, we check vital signs, the weight and so forth. We may perform an external exam of the genitalia depending on the complaint, especially related to period and period flow. We need to look sometimes and make sure that there is not any anomaly or abnormal structure where the hymen is. Look for signs. Even hair bumps can happen as puberty begins and so forth. So we may perform an external exam. I always invite the parent, or require or mandate the parent or guardian back into the room for that part, by the way. When I said alone time, I really just meant talking to that kid initially in a conversational style, kind of relaxed and get some honesty out of them. But you shouldn't expect have fear of needing a pelvic exam unless it's in a specific situation. Now, of course, your kid can require, hey, I want my mom to stay in the room with me, and that's completely fine as well, too. Now, girls can be seen for delayed periods, be tested for hormonal imbalances. Thyroid problems crop up a lot in adolescents around age 13 or 14. We have a question. Will the parent be informed of the answers that you would have given from the child based on the questions? Well, yes. So what my style is, and that's what I could attest to, and what you can. So the step out of the room is not you're blocked out of the conversation. I would invite you back into the room, and my style more so, I would actually ask your child to in front of me, just, tell mommy what we discussed. Anyone who's brought their kid into me would understand that I would now have your child repeat what we discussed. And then I get a sense to also gauge how much was absorbed during our discussion and how much they're willing to tell you. And then we sort of have a three-way discussion. So I hope that answered your question. But if it is along the lines of something the child wants to remain confidential, it's still, because it's a minor, if it's something that's going to hurt the child or harmful to the child, or something that is hurtful or harmful to another child or anything, the parent would be informed. Okay, good. Yes, it is. Perfect. To those just entering the room, I always forget to pin the topic, but today we're doing teenagers, and I'm not going to mess with this right now, but I am sort of walking everyone through what a typical adolescent visit is at the gynae, and I would, in the past, have had like dedicated clinics for teens and adolescents, and I would show up in t-shirts and jeans and definitely try to remain relatable with them. So reasons why girls who are not even sexually active, teenagers and teenagers, will come into the office would be for delayed periods, testing for hormonal imbalances, thyroid problems crop up in the adolescent years, and they really can be the reason for a lot of multiple issues. So thyroid screening is important. Polycystic ovarian syndrome can be identified in teenagers, or at least we can put it on the radar in teenagers based on some symptoms that will happen in adolescents as well too. And a lot of these things may need treatment as well. Painful periods could be caused by endometriosis, which we know can start impacting the pain level for a period as early as age 13 or 14, which kind of sucks. But that kid will need treatment as well. So those are reasons why someone would come to the office, right? Now, if you are bringing a child to the office, understand that smoking, drugs, alcohol abuse, unprotected sex would be discussed. In the past, I would, sort of gauge the level of the child that's in front of me, and then proceed with the conversation based on the information that I get with them. So it will be various things based on age grouping. We will talk about puberty, hygiene, body odor, what to do with armpit hair, pubic hair. We'll discuss that as well. Maybe the 15 to 16-year-olds, based on statistics, we start talking about kissing and making out and STIs and even contraceptive options, the importance of exercise and mental health screening as well. All of that is what a teenager would need at a visit. Now, it would again be tailored based on the age of the child and the issue at hand. Now, after the initial visit for a young child, another visit may not usually be needed for several years. But what we've done now is made this kid comfortable with coming into the office to be seen, and as well sort of laid out a roadmap of what's coming down the line in terms of typical hormonal changes and what can happen with the body. In between the first visit and later on in life, if specific issues come up like irregular periods, very painful periods, signs of infection and so forth, then a visit could be done at that time. When we talk about the periods in teenage girls, it's important to gauge what is normal. I would encourage, pull out your phone. Let's get an app that everyone has some form of an app, a free app service, or write it down, but start tracking. And tracking is important. As early as the first period, we need to be tracking. So we talk about what is normal, what to do for relief for painful periods, why they are heavy and what's considered heavy, the timing of it as well, and when is it abnormal and bleeding in between periods. PMS is a big one for teenage girls because most times you really at that age think that it's just you going through this and you are not coping well with it and you don't communicate. So those are things that can be clarified as well. Now, every child is different, as you all know, right? But in general, if a girl doesn't show what we call secondary sexual characteristics, which is development of the breasts and pubic hair by age 13, this is important, they may need to, you may need to start thinking to bring them in. If there's no breast development at all and no pubic hair developing, and pubic hair includes the armpits and the groin, by age 13, they may need an evaluation. Now, if they have breast tissue and their boobs are growing and they do have the pubic hair, the period may not come up until about age 15. If you have a child with breasts that's developing and pubic hair, and they reach the age 15, then I would say seeing the gynecologist is a must at that age. Okay, so Queen Kellyanne, hi. So Doc, could someone's weight hinder them from conceiving? Wow. So that is a separate show. I would instantly say yes, but the yes has several layers to the answer. But the answer is yes. And it depends on the weight, because underweight, overweight, the answer is still yes. They can both affect fertility for sure, right? Now, if a girl doesn't get her period by age 15, coming back on track, it doesn't necessarily mean that something is wrong or she's going to have issues. But within the first 2 years of the first period, the irregularities are expected, and your child may have delays. They may even skip an entire month. But if the period has been more than 2 years from the first one, after that 2-year window of some irregularity, you should have a teenager with a fairly regular period at that point in time. You have to pay attention to menstrual pain in kids, especially if it's excessive. Remember, they would have no gauge after getting their first couple periods as to what is normal pain and what's acceptable. So some pain with the period is normal. It sucks, but it is normal. And girls, most times, young girls should be able to manage with their routine cramps over-the-counter pain medications. If it gets to the point where it's not controlling it, that's when you start to think, well, maybe something is wrong with my child. If the period is so heavy that they're changing their pads, and some more advanced teenagers may be using tampons, if there's a 1 hour window where they keep needing to change, that is a heavier than normal flow. And then their period cramps really should start improving as the period continues, and it should not continue to interfere with daily activities. If any of those things are of concern, then that's another reason to see a gynecologist as well. And a young girl should be evaluated again 2 years out from the first period. If there are irregularities, they should be evaluated. If the period comes more than every 3 weeks, that's every 21 days or sooner, that is too frequent. Something might be wrong, or it just needs to be regulated somehow. And then if it takes more than 6 weeks to get here, and it's a 6, 7, 8 week delay, then also that's going to be an issue as well. Now, PMS in teenagers is important. The mental health status of teens is always a great concern in any society because of, suicide and self-mutilation, which is also known as cutting and so forth. And a lot of that may be rolled in for a young girl into how she manages and copes with her PMS. So this is important. PMS is when a girl has, moods and body changes before or during the period. It's usually at its worst about 4 days, 3 days, 2 days right before the period gets there, and then it goes away 2 to 3 days into bleeding. Now, that is important because if the symptoms continue way past the period and the period is ended and the moods and the crankiness and so forth are continuing, then you have to start thinking as to whether or not your child has more than just PMS. Now, the list of PMS symptoms for a teenager is a little longer than someone who's in their 20s, 30s, and 40s. There are some things a teen will experience more. So I'm going to go down the list. Sadness, mood swings, crankiness, anxiety, tiredness, food cravings, which can be crazy, pimples. This is important to know as well. Bloating, backaches, sore breasts, headaches, constipation, and diarrhea. These are all features that until the periods get regularized, more teenagers may experience this in their teen years, and then it improves as they settle into a better rhythm. So it kind of sucks to be a teenager with a period some days. Now, the PMS symptoms, you really can try to relieve these at home as well. To help with food cravings, you want to eat a balanced diet, get the sugar from fruit and fruit snacks, some fiber from veggies. Avoid gaps in snacks, which is important with teenagers as well, especially our teenagers who throw up a lot with the period. A lot of times that nausea that's happening is actually their blood sugar is quite low. They would have had a day or two of cramps and PMS and picky eating, and the sugar runs low, and that actually is an issue that can cause the nausea that teens experience. So you want to avoid gaps between meals and snacks. Keep the meals light but frequent as well. to ease bloating. Again, these food cravings, this is the kid who's eating Cheetos and everything salty inside. You actually want to lower the salt in the diet to avoid these issues, and that helps to ease up with the anxiety and the crankiness as well too. Let your teenager go to sleep. Let them sleep. They're tired. Let them sleep. If they're experiencing their premenstrual symptoms, sleep is important. And avoid caffeine and sodas and so forth, which can add to irritability in young children quite more frequently than adults. So you want to cut back on caffeinated beverages like Coca-Cola and so forth around that time. Heating pad is a must for most teenagers, as they're kind of relating to what a period really may feel like. So you want to keep a heating pad handy. Show them how to use it safely. This is important, especially if it's like hot water bottle and so forth. You want to be present or teach them how to handle that, or just use an electric heating pad, which is important. And that would reduce the need to take medications for cramps, usually for a teenager. Exercise, I always talk about yoga. And then Advil, Aleve, ibuprofen, these are anti-inflammatories that are over the counter, and you take them with a full stomach, and that will help a teenager adjust as well too, and teach them the timing of taking these and when to note the pain. And it's important, especially a teenager who may end up having endometriosis or really severe periods, it's important to actually address the pain earlier rather than waiting until that day 2 or 3 when it's quite horrendous. That's important as well. So the timing is key. And then if your teenager suffers with pimples, that especially scarring, you want to teach that child skincare routine, the importance of routine, and try to get to a dermatologist earlier rather than later, because a teenager who is taught by a professional how to manage their acne and their pimples will do better as an adult as well too, and it can be quite disfiguring. And then with PMS within there, again, suicidal thoughts, I feel worthless, self-mutilation, you want to seek the right assistance, and it's usually okay to start with the school as well too. Okay. Now, by about 2 years after the period starts, you want them to be I see a question here from Chris. And Avi, yes, 30-something years ago, Doc. You would have needed this info. I agree. Now, if Advil or Aleve does not help, is that a cause for concern? Yes, absolutely. I mean, if the over-the-counter stuff is not working for a teenager, then that would be a cause for concern about something like endometriosis or a cyst on the ovary or something more structural going on that would warrant an evaluation. But as I was explaining, if the over-the-counter medication is taken in the right timing, so a lot of times you may end up taking a painkiller for that period pain when you're rolling, that kid is vomiting, rolling on the floor, and finally has the painkiller. It won't work as well. You try to nip that inflammatory change a bit early, around day 1 or even the day before day 1, and you may end up needing less of those. Right? So I hope I answered your question. Now, I would also talk to teenage girls. So that was the period. Extended menstrual cycle. Is this for a teenager? Yes, so the flow, as I was saying, if it's more heavy, changing more than 1 pad, or more advanced teenagers, a tampon per hour. And again, it still applies. The average period would be between 5 to 8 days. For teens, it could be as short as 1 day. But once we're heading 7 to 8 days, then that's excessive as well. If the period in a teenager comes every 21 days or sooner, that's too soon. Something might be wrong. If it's more delayed than 6 weeks out, and even more delayed over time, then that's another cause for concern, and those would be considered irregular. Right? So I will also talk to teenage girls at my teen clinic about their lifestyle and, having healthy bones. I would teach them signs of UTI, what to look out for. UTIs tend to sort of have age groupings. A young, non-menstruating 8-year-old who spent all day at the beach in a swimsuit or in a pool may develop a small bladder infection or yeast infection, and that has to do more with their low estrogen status. And then UTIs may develop in the first few years of starting to have sex in a hopefully ready teenager. So I would talk to them about when to notice signs. I would talk to them about vaginal itching, what's normal or not normal, and when to be concerned and what to do. And then, of course, vaginal discharge is a big one that a teenager would have some questions about what's normal or not. And the key thing is that teenage girls actually tend to have more vaginal discharge, and that's when we were all teens, and that's when you started using panty liners because there's more vaginal discharge. So that can happen at first, especially because the first 2 years there's some irregularities in ovulation. So I teach them about that discharge being a bit heavy, and then what is normal versus what is not normal. And it's more important to keep underwear dry, or change the underwear, or if there's a lot of sweating or sports and activities or dancing, to keep the area dry as well. I teach them about hygiene. And then some girls may not have much discharge at all. And again, all kids are different, right? So this is depending on their body type and their hormonal balance. But in general, the vaginal secretions or vaginal fluids in a teenager should be clear, white, or off-white. That's it. Those are the 3 colors we're accepting. Anything beyond that, we would start to be concerned about infection. That might be an issue. So the signs that there might be a problem with the vaginal discharge in a teenager, and what I try to coach them on, is to understand their odor and what's their normal everyday body odor, or when they need to shower or not. Start to differentiate that, especially noticing an unpleasant odor, because a kid could tolerate an unpleasant odor for some time. So it's important for me to sort of get into their heads about what's normal or not. And then the change in the color. I just said that discharge should be either clear, white, or off-white. Those are the 3 colors we're accepting. So anything that's green, greenish, grayish, yellow, brown, anything looking like pus. I actually in the office have like a card that I would show a teenager, like what color, point to me what color, because remember, most times if they're not sexually active, I'm not actually going into the pelvis. So understanding and noticing their color of the discharge is important to know when a kid is having an issue. If the discharge is frothy looking, chunky cottage cheese, and then tie that in with their vaginal itching, and understanding the anatomy of their vagina and their vulva and their labia and all of that. Any kid from age, I would say 15 and up, really would soak all of that information up quite well. And learning what is not a period and what is a period. Now, infections are not usually sexually transmitted in the younger teenagers. Yeast infections happen right around becoming a tween to teenager, when there's estrogen imbalances, and you're going from low estrogen status to becoming, it's going into puberty. And again, that's a kid in a swimsuit all day long, and then they develop a yeast infection. It doesn't have anything to do with sex. And I have had experiences where parents brought a child in with a yeast infection thinking the worst has happened, but they are quite common in that transition age group. BV happens in teenagers as well too. Nothing to do with sex. Bacterial vaginosis can happen in a virginal individual, and it would be more so that unpleasant foul odor, and it has a lot to do with vaginal pH. And I would talk to them about their snacking and why they hate water and the importance of a healthy vagina, right? But in the sexually active teens, or the ones that I can sense are sexually active, we definitely may throw in gonorrhea, chlamydia screening, which we can do through their urine, even without the invasive exam. I would usually discuss it with the parent, and of course the parent who's there for the visit will know if I'm screening for certain things. But in some cases, I still would at least provide avenues, and with a teen in the discussion about their sexual health, I'll sort of make sure they know that if they have concerns, even if they don't come to me, there are services and outlets to get health screening done as well too. Right, so KBS is asking what age is considered a tween. I made that word a thing quite a while back, teenager. I've seen it definitely, but the true definition, I don't know. In my head, a teenager is that 8 or 9-year-old who's already behaving like a teenager. So it's somewhere between like 9 and 13. They're 12 and a half years old. That's a teenager, right? And then in terms of the age groupings, the official age for adolescence and puberty for girls actually is age 10 to 14, which I mentioned earlier. And puberty in boys is age 12 to 16, because boys are a little slower with the puberty onset. The other thing I would talk about in an adolescent visit with young girls is sexually transmitted infections. And I show pictures. I mean, these kids are all over YouTube and Google anyway. But I talk about reducing their risk, talk about HIV, and, just routine screening down the line that they may need to remember to sort of keep in mind. Teen pregnancy is not new. Teen pregnancy is not going anywhere. Teen pregnancy continues to be, a worldwide occurrence. And again, catching them in that adolescent stage at a visit, I would talk about birth control. And first I would see where they sit and where they lie with it, and then sort of fill in blanks and sort of correct myths and make sure that they're on the path for facts in where birth control is concerned. And of course, I would always impress, options of preventing pregnancy over having to deal with a pregnancy that has happened. But it's important to sort of let the teenager talk so you can gauge if they have social issues, where to put them more at risk for teen pregnancy and so forth. Right now, teenagers do have the highest risk of getting a sexually transmitted infection over any other age group, right? Teens need to be educated that STDs or STIs, same difference, are diseases that can be passed from one person to the other through sexual contact. And even as a parent may have some reservations on how am I going to bring this up? How am I going to talk to my kid about this? Try to start early, depending on your kid. Remember, I said every kid is different, but they're getting this information on their tablets. They're getting this information from their schoolmates. They're getting this information. And studies have shown that the young teenager from age 12, even up to 15, trust their parents' opinion still. So don't give up hope on your kid, and try to remain a source of information for your child, which is key as well, because teenagers need to be educated. If someone in their entire lifetime gets an STI, it tends to actually be at the stage of teenage years. And what I also say to my teenagers is you don't have to even go all the way to contract or get STI, right? All the way meaning anal sex or vaginal sex and penetrative sex. So I explained to them that some STDs just require skin-to-skin contact. HPV, herpes, I would describe that to them. Oral sex, they may think that I'm not completely going all the way, so this is safe, and I would try to educate them on that as well too, because that's important. And many of the STDs that you get as a teenager may not even have symptoms, but they may follow you along for the rest of your life, right? Herpes has no cure. Chlamydia, you get most times from age 18 to 25 is the most common diagnosed population, but someone in that age group may not find out they have blocked tubes until they're in their 30s trying to conceive and they can't. So that's why it's important. Again, start early. Don't assume your child doesn't know, but understand your child as well too. And make sure they know you don't need to go all the way, right? That's important. I would also tell a teenager, if they think they're ready to have sex, I usually say, you have a boyfriend, girlfriend, dog, cat, kind of make it conversational with them. I talk to them about consent. And you should talk to your daughters about consent and what it means to give consent. And as we sort of put these words and drop these terms in there, they will retain this information, and it could save them from some pretty scary situations. So, I talk to them about whether they think they're ready or not, if their body is ready, if they have fears about it, who in their pairs, because Mama said young teenage girls start following their peers more than their family. So who amongst their peers, I talk to them about that as well, because they may have a peer with risky behavior that concerns them. So that's important to talk to as well. So consent, and also as they start dating as young teenagers, your partner should respect your right to say no, and you always have to stop if you don't feel that anything is right. So that's important. And then learning how to protect yourself and being in safe environments, and alcohol use are important things to just start dropping those terms in with your kid, and you would be surprised how ready they are to talk about these things, and you're the one with the reservation all along. And try to remain relatable and make it conversational as well too. I always would tell teenage girls that the surest way to not get an STI is to not have sex, right? So I start there. Especially if mommy and daddy's in the waiting room, right? I have to start there. And I would say that, the definition of sex, because I've come across teenagers who don't consider anal sex as losing their virginity, oral sex as well, and then what abstinence truly means. If they decide to have sex, what their avenues are, if they think they have an STI, or if they are pregnant, right? Teen pregnancy. In some moments, condoms can be discussed. That's another one that's a little touchy. Again, it depends on the child in front of me, but I will always mention them if they're leading me down a path that, hey, I have been doing some stuff. And I try to encourage girls and women in general to not shy away from the topic of condoms with their partners as they're dating, and teenagers lead to your late young 20s and late 20s and so forth. And I know when a teenager is introduced to the idea, they're more likely to follow along with that as well. And then they are also sometimes asking me about monogamy and their sexuality and so forth. So again, brace yourself. Be ready to sort of, once you start the conversation with your teenage girl, just brace yourself, because there's some stuff she already knows that you don't know, that she knows, if that makes sense. And if you start seeing cause for concern, then definitely discuss with your doctor as well too. Especially if you suspect your child is having sexual activity, it's okay to bring your child in for that reason as well. And that's where you would set out, and then we would sort of push through with a visit as a one-on-one as well too. So that's important. I almost forgot to say that. If you think something's going on, you can also still book an appointment for the gynecologist and let the doctor sort of engage with the child, because it's still ultimately going to help your child. We would impress on mixing alcohol and how much is safe alcohol use, and also a teenager is more likely to make poor decisions under the influence of alcohol and any other drugs, and they're more likely to end up in situations where there's rape, sexual assault, and also they are more likely to have sex with someone they normally would not have sex with, right? We would then also just encourage understanding the role for the pap smear and HPV screening and the HPV vaccine as well. Now, the other little peg of being a parent of a teenager in this day and age is understanding sexuality and relationships with your kids. Things are changing. You want your child to always be healthy and safe. And as a teenager, they will start to have romantic relationships. And that's where I talked about consent and consensual sex. And then also the terms lesbian, gay, bisexual, transgender, queer, those will surface in your household, because guess what? Their peers or themselves are going through transitions where these are concerned. So it's important, key points about sexuality. So your sexuality of your child is a part of who your child is and who they will become, right? So you have to start to feel comfortable. Hopefully you already feel comfortable with sexuality and understanding that it's important for your child to develop in a healthy way. If you can accept what your child is choosing as their sexuality, you will sort of continue their healthy development. And if you need support, there's support groups to get you through it if you don't understand what's going on. But it's important to remain open where your teenagers are concerned. There's a sector of society in most major cities of disenfranchised children who were teenagers and they've chosen a sexuality that their parents don't agree with. They end up what we call couch surfing, where they stay by a friend's house and then they stay by this friend's house, and there's a lot of instability and they're essentially homeless but not homeless, and there's a huge reason behind that where they sort of disclose their sexuality. So as a physician, I also use that a moment to ask parents to open their mind, because do you really want your child under a bridge or couch surfing, because it's such a transitional time for them. And what a lot of studies in the UK and the US show is that teenagers may not land on that sexuality as adults. Again, a lot of experimentation and teasing out what they feel is happening at that time. So just try to maintain attractive communication with them, because they will experiment, and this is still normal and natural at this time as well too. Right? And then the final thing I would touch on with your teenage girls is to identify or look for signs that your daughter or niece or whoever is the person in your life is actually in an abusive relationship. There is a difficulty in teasing out when a teenager is in an abusive relationship, because it's usually not hitting or slapping where you can physically see it. I mean, that does happen as well too, for sure, but emotional abuse and just a lot of misunderstandings of how relationships should work tends to happen in the first few relationships that a young girl would be. So you want to keep those conversations open as well. Right? So I did say a lot tonight, and I touched on what an exam would be like usually when you bring a teenager in to see us for a gynae evaluation. Again, it does not need to happen yearly, right? It would be more if there's an issue initially with puberty, breast development, hair development, irregular periods, which we accept within the first 2 years after the first period. But after the second year has passed, your child should be on a regular track. And then things like acne, we may need professional assistance with, and other hormonal imbalances, right? And within that visit, sex, sexuality, STIs, they're sort of added in there. You as a parent, with this information I talked about tonight, you can just start again introducing it casually, opening the communication so they feel comfortable and they don't feel judged. And they sort of realize that, hey, my parent is relatable. All right, so if anyone has any questions regarding this, I think I missed a question earlier. I'm sorry, I was trying to stay on track. But if anyone has any questions, you can certainly ask them. What I'm going to do next week is part 2, and we're going to talk about hair, skin, hair on the body, and body odor and hygiene as well for teenagers. That will be the part 2 of it. And what I'm going to encourage is, if you want to sort of get a question answered next week as well that pertains to what we're going to talk about, you can add that onto tonight's post, right? So again, I am really appreciative as always of your time. You could be doing anything else this evening, so thank you, and thanks for having me back on a Wednesday. Right? So everyone keep well and look forward to the post that's coming up now. Good night.